Dear participants of the conference, we are a team from the Czech Republic from Faculty of Arts of Charles University in Prague and Faculty of Education of Palacký University in Olomouc, and we would like to introduce you the topic of articulatory movements in speech and language assessment. Speech sound disorders are among the most common communication disorders in children. They have negative impact on child development, especially on academic, social and literacy skills, and they may result into the formation of communication barriers. That's why the comprehensive assessment is needed, as was stated in NetWest project, for example. Among core competencies for new practitioners, we can find that speech and language therapy practice requires a strong integration of theory, evidence-based practice, and interactive clinical skills, including the ability to assess speech and language disorders using systematic data collection and a range of assessment methods. Speech and language therapists must possess a diverse set of knowledge and skills related to the diagnosis and treatment of speech disorders. But despite the fact that the topics are included in training curricula, their practical application remains underexplored. Only little is known about how speech and language therapists assess speech motor skills in practice, or about specific focus of such assessments. There are no established guidelines defining age-appropriate articulatory movements or standardized methods for their evaluation. But we may consider recent advancements in speech motor control research and technological innovations, such as real-time ultrasound imaging of the tongue, suggest that such standards may soon be within reach. To prepare speech and language therapists for the integration of this knowledge into clinical practice is very important, but first is necessary to understand current assessment practices regarding articulatory movements and subsequently adapt educational curricula accordingly.
To better understand how articulatory movements are currently assessed, we conducted a survey focused on fricatives s, z, sh, zh, and the trill r. These are motorically complex sounds that include both voiced and voiceless pairs, and they are frequently addressed by Czech speech-language therapists. We received responses from 83 speech-language therapists, however, not all of them completed the survey. As expected, all respondents reported using auditory perception to assess speech. Almost all also rely on visual analysis, suggesting they actively observe articulatory movements. The assessment is most commonly based on a self-made three-position picture naming test, as well as on spontaneous speech sample. The identified errors are typically classified with traditional classification labels such as interdental, lateral, palatal, which primarily define place of articulation. Looking more specifically at articulatory movements, we can conclude that nearly all respondents pay attention to the movements of tongue, lips, and jaw, and to the airstream direction. There's little difference in the assessment of fricatives and trill. However, velopharyngeal closure and vocal cord movements are mentioned far less often, especially for trill. Overall, while speech-language therapists are clearly paying attention to key articulators, the assessment of articulatory movements appear to be inconsistent.
Speech-language therapists use different types of speech to assess speech sound disorders. They use auditive and visual analysis and classify errors according to a traditional system, which, however, has its limitations. They observe some articulatory movements, but not all, which can lead to incomplete assessment. To improve the assessment of speech sound disorders, it is important to better understand articulatory movements and their role in speech production. There is also a need to establish standardized protocols for their assessment, to use more detailed error classification systems, and to modify curriculum to better prepare future speech-language therapists for clinical practice. In case you have any questions, we will be happy to answer them. Thank you.